years. These disorders are currently estimated to affect as many as 1 billion people worldwide, and the number is expected to increase as years pass by. So what can be done? Most of these disorders have no cure, while the other surgeries are far too risky. Fortunately, in the recent years, there has been a development in the field of regenerative medicine whereby stem cell therapy has become available to doctors as a new treatment method. The greatest impact of stem cell therapy has been on otherwise incurable pediatric neurological disorders. With increasing research in this field and greater publications coming out showcasing the safety and efficiency of the stem cell therapy, a drastic and considerable shift is happening in people's approach to these disorders. This is Dr. Alok Sharma, Director of Neurogen Brain and Spine Institute, Professor of Neurosurgery and a Head of Department at LTMG Hospital and LTM Medical College. Doctor, this is a great establishment that you have here, and it's an absolute honor to carry forward this research. What was the aspect that made you want to carry forward this research and execute stem cell therapy?
That's a very good question, because the genesis of this goes back to when I was a student, which is why I always emphasize what happens in our student years. I was in my final year, and at that time what happened was that I was in the ward and I saw a paralyzed patient lying there with his food uneaten because he was unable to eat and nobody could feed him, and his urine had come out and he was lying helplessly. So I asked the doctor who was taking the round, I was just a student, "Doctor, why can't we do something about this patient?" And he said, "Oh, we can't do anything, he's a spinal cord injury patient, he's going to die anyway." And in that moment my eyes connected with the eyes of the patient, and I saw the anguish of an alert mind in a body which will not respond. And in that moment, as a 22, 23-year-old student, I decided that my life will be about trying to help such patients. And since then, my life has been just one mission: how to help patients with irreversible neurological damage get back power in their hands and legs, get back their ability to speak, and get back their intellect and higher functions. So that really is the genesis of all my work.
What are the different types of stem cells that are used for therapy?
So stem cells are, broadly speaking, of two types. Allogenic stem cells, which are stem cells that you get from the outside, and autologous stem cells. These are stem cells that we get from our own body. Now, allogenic stem cells are again divided into two broad types. You can get stem cells from the embryo, that is either from the aborted fetus or from test tube babies. These are called embryonic stem cells. You can also get stem cells from the umbilical cord, which connects the mother and baby at birth, and these are called umbilical cord stem cells. Now, embryonic stem cells are the source of a major controversy. There is a lot of ethical issues about it. They are also potentially dangerous. So most people all over the world, we do not use embryonic stem cells because of the ethical considerations and because of the potential dangers. Umbilical cord stem cells in comparison are safer than embryonic stem cells. But the other group which I was talking about, that is autologous, this is the bulk of our work. These are stem cells we get from our own body. Our body is rich with stem cells, and there are some areas from where we can actually extract them. The most easily accessible is from the bone itself, and what we do is we put in a needle into the bone marrow and we can take out autologous stem cells. You can also get stem cells from the fat in our abdomen, and you can also get them from the teeth, from the pulp of the teeth. So these are the areas from where we can get autologous stem cells. A new type of stem cell that is evolved is something called iPSC, induced pluripotent stem cells, where we take the body's own cells, which is autologous, and change the inside. And so these are autologous cells that behave like embryonic stem cells. And for this research, Professor Yamanaka got the Nobel Prize in Medicine just 2 years ago. So broadly speaking, they have allogenic, you have autologous, and you have iPSC.
So what are the three main neurological disorders that children face worldwide? Autism. Autism is a mental condition characterized by great difficulty in communicating and forming relationships with other people and in using language and abstract concepts. Cerebral palsy. Cerebral palsy is a non-progressive brain injury or malformation that occurs when the child's brain is underdeveloped. Cerebral palsy primarily affects the body's movement and muscle coordination. And mental retardation. Mental retardation or intellectual disability exists in children whose brains do not develop properly or function within the normal range. This is Ms. Ridhima Sharma. She's a psychologist and behavioral therapist working at Neurogen. So, how do autism, cerebral palsy and mental retardation differ from one another?
Autism, cerebral palsy and mental retardation, as we all know, they are neurological disorder. Coming to autism mainly have different kinds of symptoms, like if we talk about main symptoms, then the children with autism have stereotypical behavior as in repetitive movements, repetitive actions, things like poor attention span, poor eye contact, poor cognition level. They are very hyperactive. Their social interaction is affected. I mean, they usually prefer to stay aloof and they don't mix up with other people. Coming to cerebral palsy, a child or any adult with cerebral palsy, they have more of physical issues like dystonia, spasticity. Coming to psychological issues, yes, they have cognition affected, but this is again differ from patient to patient. There are some patients with cerebral palsy with a very good cognition, very good attention span, but there are most of the coming to pediatrics, like pediatric cerebral palsy patients, they have cognition and attention span affected, poor eye contact again, and as we all know, the speech is equally affected, so it becomes very difficult for them to understand the day-to-day things, like starting from ABCD or maybe numbers. So then they are unable to go to school, so because of that their academics and everything, their understanding, cognition, it gets affected. Coming to mental retardation is basically a disorder when a psychologist is doing an IQ test and the test score is less than 74, then we can diagnose that person as having mental retardation. In mental retardation, usually what happens is non-performance in school. Again, the child is socially isolated.
The surgery is split into two parts. So first they extract bone marrow from the hip bone, which consists of a lot of stem cells. They need to extract around 100 ml of bone marrow, which is then subjected to purification and separation processes in the stem cell laboratory. In the laboratory, the stem cells are separated from the rest of the blood by using a method known as centrifugation, which is a density gradient process. They use raw mixture of mononuclear cells consisting of different stem cells, because instead of getting one benefit, it's like you're getting 4 benefits. The next part of the surgery is to inject these stem cells back into the body. Using a lumbar puncture needle, the stem cells are injected into the spinal cord and they have to travel through the cerebral fluid. This entire process consists of only suffering 2 injections and isn't a major surgical procedure. So how do these stem cells help to improve these disorders? So once these stem cells are injected into the spinal cord and into the cerebral fluid, they travel through the central nervous system. Now, these stem cells are intelligent enough to move towards the damaged area, and now they can do 3 things. First, they can either go and replace the damaged cells in the brain. 2, you could say that some cells in the brain are asleep, so they go and stimulate these cells to wake them up so that these cells can perform their function. Or 3, they can form blood vessels near the damaged area so that more blood and oxygen can be supplied to the brain. What is the role of a psychologist to improve these disorders?
See, whenever a child or any patient who comes to a psychologist is referred to a problem areas of the child into consideration, we take the detailed history including the developmental history, the family history, schooling history, what is the present academic status of the child, and other problem areas into consideration like the child's attention, concentration, cognition, the child's awareness and judgment, and the child's social interaction. After that, we do some psychological tests, like for autism, we use a childhood autism rating scale, and we also have some DSM-5 ADHD autism checklist, on the basis of which we can assess the child, and then we can plan an intervention plan accordingly. After the assessment, what we do is, now we have got a brief idea as to what is the issues and what are the problem areas. Then we refer the child to different therapists like occupational therapist, speech therapy, etc.
So after the stem cell therapy, patients are required to do neural rehabilitation, physiotherapy, occupational therapy. They do this to be functionally independent. These rehabilitations help the patients to do their day-to-day functions, and exercise helps the stem cells to work properly. Have you been able to see considerable changes in a patient's behavior post-surgery?
Actually, now that you asked, yes, definitely I have seen a lot of changes in patients' behaviors post stem cell therapy, especially in children with autism. In autistic children, we have seen that there are a lot of positive changes in their behavior, say in around 1 to 3 months of post stem cells. Yes, we have seen a lot of changes.
Does rehabilitation along with stem cell therapy help to treat these disorders?